Hello everyone. Today we have Dr. Bobkingston, who has cleared his FMG July 2025 FMG examination, with a whooping score of 200 in his very first attempt. Congratulations, Doc. We are so
Mm,
proud of you.
Thank you so much, doctor. Thank you.
How does it feel right now?
It feels surreal. It's first time, and with that score, I feel like a lot of dedication, a lot of discipline went into it, and I feel like uh, it's a good score. And yeah, I'm just happy right now.
So, describe the exam day for me? Like, what exactly happened on the exam day? Like, result day.
On
How
the
was
result
it?
day, okay, so I was sitting in my living room. I was watching TV with my mom and dad.
Hmm.
And then I got a message on the group. The list comes, and then I open, and I was searching for my name, and my dad came. He looked me in the eye, and he was like, "Don't worry, I know you will get through." But my mom, on the other hand, she was like all tense and worried. And then I show her like this is my number, and then she searches it, and then she sees a 200, and she couldn't believe it. Then she said, "Send it to my phone." And then she checked it in her phone, and she said, checked in my dad's phone again. She did that like she did that like 10 times.
She didn't believe in you.
She didn't believe.
No, but
Uh,
I think everybody must have been very proud that day.
yeah, and then she was very happy after seeing that.
Describe the exam day for me. Was it easy for you, or what exactly? Describe the whole day for me.
The exam day. Okay, so me and my friends who were having the exam on this in the same center, we went early in the morning. And we went and sat there, got our seats and everything. We still had like 30 minutes left to start the exam. So I was tense, like everyone is, I was tense and nervous. And on top of that, I believe a lot of people don't talk about it, but in my center especially, it was number one, it was in Chennai. So it was
Hmm.
very hot.
What?
And there also happened to be a road beside, just next to the window. And there were a lot of cars going, bikes going, honking, people yelling. So all
Hmm.
of that was very stressful. And on top of that, I could feel my sweat dripping down my shirt and my face. The whole environment was stressful, and I was nervous. And the exam started, and I only knew one thing: should just look at the screen, answer every question one by one, not get distracted by the environment around or any other thoughts. And even in that moment of stress, I remember Dr. Khalil's words, 149 equals to zero.
You.
Uh, 150 is not equals to 300. So even in that dire situation, his words came into my head, and I believe like that did push me to give my all in every single question. And when I was doing my last set of 50 questions, I was happy and relieved. Like these are the last 50 questions that I have to do. And at the end of the day, I walked out satisfied, giving my all. And yeah, I was actually happy with the exam.
Okay, so let's get a basic introduction about you. Like, give me a background before your FMG and even before MBBS. Tell me everything about you, where you come from, everything.
Okay, so I'm Bob Kingston. You can call me Bob. My dad and mom are from Andhra Pradesh, but they worked in Gujarat. So I was born in Gujarat. And then when I was 10 years old, I moved to Jharkhand, where I am right now. You know Dhoni, right? So Dhoni lives
Yes.
like 30 minutes away from me. I was here for the last 10 to 15 years. And then I moved to Philippines. I joined through Transworld, and then I went to Philippines. I did my 5.5 years there. And then I came back, and then I joined the team of Arise,
Mhm.
who really helped me get through this. And I want to thank all of them. And then it was August 14th, uh, the
The
last
result.
date, the result date. And then that's when I became, I guess, Dr.
Doctor.
Bobkingston.
So, whose decision was it to become a doctor? Like, what
Uh, it,
motivated you?
it was mine. I just told my dad, when I was like in 10th standard, I want to become a doctor. And then
Hmm.
he said, okay, yeah, I'm very blessed to have parents that support me. no matter what I do, they're always there for me. And even when I was in my 12th standard, I was having my graduation and they told me, what do you want to become? And without a second thought, I said, I want to become a doctor.
Mm,
And today, looking back at that, uh, I feel like
you made a
that
good choice.
I made a good choice, and that 19-year-old boy would be proud of me right now.
Oh my God, I really have to clap for that. So, why did you decide to choose DMSF for your MBBS? You actually did it from the Wow Medical School Foundation in Philippines.
Yeah,
Yes.
DMSF actually recall very well, but heard about this transfer educare, and through that, people are going to the Philippines. And I heard the Philippine education system is actually good. We have the OSCEs and all that. And actually, when I was there, also the education was good. The OSCEs especially, they helped me a lot. They made us wear scrubs and go talk to the patients or how do you suture, and they tested us upon that. And I believe that was a very strong foundation for whatever I know right now. And I'm really blessed to be have that college, be acquainted with that college.
So, did you have clinical exposure or how were your academics and campus life, though?
Back in the Philippines, for the fourth year, we were clerks, right? So they did send us to various hospitals based on our modules or the subject. So first, I had like community medicine. They sent us to the community. We had to go to the community, take like reports of the patients, and then make reports about that. And then we had medicine. I was lucky enough to rotate in one of Davao's biggest hospital. It's called SPMC, and I
Mm,
was actually there were a lot of patients.
government hospital, yes.
There were a lot of patients, especially in the ER. You know, uh, as a medical student, I feel like they do not see us like a very important person. Like they don't give us a lot of job work. But when it came to SPMC, I was actually fortunate to have work. They would tell me to go and do this and that, and I was actually did quite learn quite a few things.
So, do you believe that the clinical exposure that you had there built a foundation for your FMGE?
Oh, it did. It did like a lot of things, like little things, even if it was like the Riles tube, if you put an NG tube,
Mm,
Dr. Khalil teaches us that it should be like 5 centimeters above the bifurcation. And all of the little things, even if I just did it then, I came to Arise or my came to my books and then I learned why I do that. And so it should be that combination of clinical and books. So I feel like I do have a good foundation.
So tell me, like, how did you begin your FMG prep? When did you start it, and where did you do it? Was it offline or online?
So like I said, the first 3 years of my med school was not very great. Okay, so I actually started studying in my fourth year. I had a friend where we sat together, whatever module rotation we had, we would go in the morning to the duty, come back in the evening, and even if it was like for an hour or 30 minutes, we used to sit and watch like online videos, from other platforms. And then I felt like that did create a base for uh, my preparation in FMG. And when it came to September, we were introduced to ICE, and Dr.
Mm.
Khalil came to DMSF, and then he told us that I will give you all the videos that you need to. I will give you all the resources that you need. You start studying from right now. So it was back in September last year where I actually started my preparation, and then I feel like, yeah, it was then where it actually started.
That's amazing, Doc. What about later? Once you came back from Philippines, what did you do?
So
So,
when I came back from Philippines, by now I had already joined Rise.
mm,
The main reason I joined Rise was I think I texted you about this. I asked you if Dr. Deepak Marwa and Dr. Vich were going to be a part of the team
mm.
in Chennai. And then you told me they're going to be, and without a second thought, I just joined Rise. And
So,
then
how was your experience in King's Arise Chennai campus?
it was good. It was very good. The place was amazing. The place is still being built. Okay, so even though it was not very great, it didn't check a lot of boxes. There was good. There was food. There was a place where you could study. It was away from the city. There was no noise,
Clean, fresh air.
and the place was clean. So I believe I needed that, away from the city, away from distractions. A place where I won't be distracted.
I think
And
that was the best thing, right? Because there is nothing around. You're
there was nothing
isolated.
around. The closest small cinema theater is like 30-40 minutes away. So,
Hmm.
so even if you
So,
wanted to go, you think twice.
yeah. So it kind of isolated you to just study, right? So the whole program included 19 subjects, regular classes, and then we had your QRP, like we had our TND and then QRP and FTR, right? So were you
Yes,
able
ma'am.
to go through the whole schedule?
Yes, every single one of it. I made sure not to sleep until I finish the day's syllabus. The doctor comes and teaches us, and I
Mhm.
made sure to finish each and everything on the same day and not logging up for the next day.
And how many questions per day did you do?
Um, Questions per day. I think initially I started with 50, and when it
Mhm.
came to like 30, like when it came to the last 3 weeks or something, I started doing 100, 200, and yes. And when it came to last week, I only did questions. So
And how many GTs did you give? And was it important to give GTs?
I would say GTs were very important to me.
Mm-mm.
I'll tell why. Because it was not mainly for me to assess how much marks I would get, but it was important for me to know if I was able to sit 5 hours without any distraction. I did not want to see how much marks I would get, how much improvement I would do. That was aside. Aside from that, was if I was able to sit for that time, for such a long time, because I believe a lot of us need to cultivate that habit of sitting 5 hours. Even Deepak Malwa, Dr. Deepak Malwa, in one of my classes, he told, you will write the first part perfectly. Once you eat your lunch, that's when your post-lunch syndrome kicks in. So that's when you will like start getting drowsy, and that's where all the main subjects are: OB-GYN, surgery, medicine. So, so if you're able to build that, uh, able to stay consistent for all those 5 hours, I believe it was you will get it through. And those GTs did serve a very important role for me, especially Arise ones. We had, I think, four of them. I think
Yes.
I think I did all of them mainly for that very reason.
And
And
how much did you score? Was it closer to your real exam marks?
it was about the same. It was maybe like 10, 20 marks more than that. That's it.
So tell me, like, as Dr. Bob Kingston right now, if you had to meet the FMG aspirant Bob Kingston, what would you tell him to do and what to avoid? The mistakes that you did and should not have done. As a doctor now, what would you do? Tell him.
Okay, so what would I advise? So at the start, like I said, when Dr. Khalil came to us, he
Mm.
told us this one thing: you trust the faculty, trust the doctors, trust the workbook. It was like as though I was in a maze, and Dr. Khalil and his team comes with a map saying, "This is the map. This is how you'll get through the maze. Just trust the map." And I believe that was something that I had to stick to, and I trusted him, and well, you can see what that did today, and I'm very uh, happy to listen to that.
Okay, describe a day in your life as an FMG aspirant back in King's Chennai campus.
Okay, so for example, we had like subject going on. So I wake up early about 6 o'clock. I get ready, and then Kings is a beautiful campus. If you ever happen to go there, it's a very beautiful campus. You can go anywhere. There's a garden, there is a cafeteria, there is a beautiful place to sit. And I used to go and sit there. I used to see some of my friends also who would go early in the morning, go sit there. And we used to study there for some time, then go have a breakfast, and then sit in the class. So it would be from about 9 o'clock until 6 o'clock in the evening,
Mhm.
and I would come back and then have my dinner and then study for some time with my friends and then go to bed like 10, 11 o'clock. That
Okay.
was during the time of preparation, like the initial start. But when it came after like the last month where we had no classes or anything, it was, wake up early, like 7 o'clock, stay awake until 1 o'clock, 2 o'clock with my friends, sip coffees, just get through the day. And yeah, I believe all those late night and coffees did pay off at the end.
I think having your same college friends in that campus really played a very big role in
It
your
did.
education, right?
It did. It did, Doc.
And
All of
with
my
the,
friends.
yeah, did they clear all your friends?
Yeah. Yeah, most of them, all of them, like all of my classmates also, a lot of them got about 200. And
Oh,
e- even though like 150 is actually a very good score to get through that, it's also a big achievement. A lot of them got about 200, and I believe DMS have had a role in that, Rise had a role in that, and
David sir had a role in that.
they were, Sir had a role in that. Yes.
I think that's the biggest thing he did. He collaborated with Kings and Arise, and I think that was so crucial during the fourth year itself, right?
Yeah,
Because
yes,
you got it, like you said, you got a direction because of that.
yes.
So hats off to him for being able to
Uh,
do that.
Big thanks to him.
Yeah. So also tell me one more thing. Your entire journey, 19 faculties, which subjects did you like and which faculties could you resonate with?
Oh, like I said, I love Dr. Deepak Marwa,
Mhm.
Dr. Prasan Vij, and then I
Mhm.
loved radiology. Dr. Khalil was amazing. You know, all through med school, radiology wasn't the greatest for me.
Mhm.
But then when he taught it, I actually understood radiology, and I really love that. And if I'm able to get good score in my PG, I might pursue that, all because of him. Thanks to him.
Amazing, amazing. Tell me, like you said, this journey you have to learn so many things, so many subjects you might not be good with, but you'll learn it as you go. But some days you're going to have the will to learn it and the motivation. But there are going to be days, right, where you don't feel like studying and it doesn't work out the way you want. So on those low days, how did you bring yourself back up?
Um, Doctor, on those low days, I would say, uh, number one, Kings did play a big role because number one, I had friends.
Hmm.
Even if I did feel low, I used to go to my friends' rooms. I used to go and see them studying, and I used to get motivated seeing them studying. So that was one big thing. A lot of people, people who got about 200, or even people who actually did very good. I see them and I was inspired by them. Them studying late nights and all. I'm not someone who actually pulls out late night studies and all, but seeing them, I did get motivated. And I feel like you need people like that in your life to get you through this kind of exam.
And tell me, were there days where you felt like you're not good enough and you will not be able to make it?
And then every single day, every single day, I felt like I was not good enough. I cannot make it. I used to go tell my friends like I can't do this anymore. And actually, the friends did help me a lot. They did tell me that you can do this. You know, even if I fail a
What was
subject,
your biggest support system during this time?
uh, I'd say my friends. They were there for me. My friends, my faculty.
Mhm.
After every lecture, they made sure to motivate all of us. It, at the end, they would give, even if it is 2 minutes, they used to motivate us, and that did help us.
What sacrifices did you or your family make for this success of yours?
Uh, well, I cannot tell exactly how much my mom and dad did for me because that's their love. They wouldn't show it even if they did. But
Mm.
from my side, I feel like uh, there were a lot of sacrifices only for studying. It won't compare to how much they did. But my little sacrifices like sleepless nights or flipping a book even if I didn't want to, all of that did pay off at the end.
What about your emotional journey? Are you close to, like, did you feel any faculty played a personal role for you?
If we're talking about emotional attachments to like a doctor who is very good with his students, that would be Dr. Nadeem. He's the man who comes first. He's the man who you see first in a rise, and he gets you to fall in love with the subject. All of the doctors were very beautifully made it possible for us to fall in love with the subjects, and I'm very grateful for all of them, actually. Uh,
I'm very happy to know that. As Dr. Bob Kingston right now, you know your juniors are going to be attempting the Jan 2026 FMG examination. So, what advices, do's, do nots, and mistakes to avoid would you tell your juniors to follow from your
Docs.
perspective?
So if they're writing the 2026 exam, they would be in the fourth year right now. And I would say whatever resources you have, start your preparation. Even if it is like an hour a day, 30 minutes a day, the major subjects like medicine, surgery, OB/GYN, these all I studied in my fourth year. When I came to Arise, it only built my foundation. On top of that, I didn't have to start from scratch.
Mhm.
So I'd say if you have that foundation, and if you come to an institution like Arise, who will build on that foundation, everything will be smooth sailing. And 200, I believe you'll get more than that.
Would you recommend your juniors to join King's Arise?
Absolutely. I actually told my friend who's going to appear for the next 2026 exam to join Arise. And this place is amazing. The faculty is amazing. You fall in love with all 19 faculty members. And yeah, they will get you through this.
Let's have a rapid fire round, okay? What is your favorite subject in FMG prep?
Medicine.
Most dreaded subject before Arise?
Most dreaded,
Before you
ophthalmology.
studied it in Arise?
Ophthalmology. I cannot get my head around it.
Morning study or night owl?
Morning.
MCQs or workbooks?
Workbooks.
You need to have a memory for workbooks.
No, you have to go it like 5, 6 times. You have to keep reading.
Okay, so workbooks or revision notes?
Both. You start with the workbook and then you end with the revision notes.
No, but is it important to maintain that memory? Does the workbook really, stay valuable? Does it come in the examination, real examination?
It does, dog. Everything that I saw on that day of the exam came from the workbook. Pathology faculty,
Divya sir.
he, Divesh sir, he told us this at his first day of our class, he told us you read the workbook multiple times.
Hmm.
You maybe do active reading twice, but passive reading should be over 6 to 7 times. Even if you're not willing to flip the pages, just go through the pages. At least you'll remember what page has what topics.
Hmm.
So, so that actually helped. I actually did read a lot of workbooks over and over again, and that did actually help.
One word for FMB.
Doable. It is doable. Yeah, don't believe what anyone says. You can actually do it with discipline and good guidance.
If I do not study 16 hours a day, I will definitely fail the exam. True or false?
False. Everybody has their own pace. Everybody need different timings. I personally needed that many hours, but then if you can do it in 5 hours, that is amazing.
I think quality over quantity, right?
Quality, yes, ma'am. Exactly.
One line for your aspirants, for the future aspirants.
Uh, Discipline. You cannot be lazy and try to get through the exam. You need discipline to go through anything in life, not just this exam.
I'm so, so proud of you, Doc, and thank you for giving me an opportunity to take such an insightful interview. We are very, very proud of you, and seeing you score 200 is such a inspirational thing. So thank you. Congratulations once again, Doc.
Thank you so much, doctor. Thank you for having me.